Namaste, I am Dr. Chandilya, the Department of Internal Medicine, used to be called General Medicine earlier. I do diabetology work extensively, and I've come here to give a talk on chronic complications of diabetes. Basically, I want to tell you what diabetes is all about. Diabetes is one of the NCDs, that is non-communicable diseases, that is very prevalent and very dangerous to mankind, which is highly prevalent in our part of the world, India. Now, diabetes can be defined or segregated as excessive blood sugar in the blood. On measuring the sugar, a fasting sugar of more than 100 or postprandial, that is 2 hours after food, postprandial sugar of more than 140 is considered to be diabetes, and at 3 months average, it's called the HbA1c. 3 months average should not be more than 6.4, less than 6.4. More than 6.4 is considered diabetes. Now, as I told you earlier, diabetes is excessive glucose in the blood, which is basically formed by reduced insulin in the blood. The excessive glucose can be in the blood vessels, or it can be from the storage organ like the liver, where the sugar becomes more than what is necessary. And it can be of two types. Type 1 diabetes, that is from your birth, and type 2 diabetes when you come to a maturity onset diabetes. Now, it can also be due to another condition called insulin resistance, where the sugar is unable to reach the target cells like the muscle or the brain, or whichever cells it's supposed to give sugar or glucose for energy. It doesn't reach, and then you need insulin to open up and let the glucose go inside. I'll come to the main topic where I have to talk is complications of diabetes. The acute complications of diabetes, acute means short term, chronic means long term, right? Acute complications of diabetes are hypoglycemia, when the sugar suddenly drops to less than about 60 milligrams or 50 milligrams or 70 milligrams, and not enough sugar is available for the functioning of the body, where it leads to sweating, palpitation, giddiness, unconsciousness. There's other complications, acute complications called ketoacidosis, hyperosmolar ketoacidosis, and non-ketotic coma. These are the acute complications, which are very rare but very dangerous. Let us come to the chronic complications. Chronic means if you have been having sugar for a long time, maybe some months, maybe some years, maybe some decades, unattended to or probably improperly attended to. That can be again be divided into macrovascular and microvascular. Macrovascular is the one that affects the large blood vessels, and the microvascular is one that affects the small capillaries and arterioles. So the macrovascular complications are coronary artery disease. If you have sugar for a long time, it can lead to coronary artery disease, cardiomyopathy, arrhythmias, that irregular heartbeats, sudden death, and then CVA, that is cerebrovascular accident, where the blood supply to the brain is cut off or partially cut off, and then peripheral vascular disease, where the blood supply and is not enough to reach the end stage of the body, like for example the legs or the hands, the last parts of the body we are supposed to supply. So it's called PVA. These are the macrovascular complications, and these are preventable complications if you diagnose diabetes earlier and then start treating with the proper medication and insulin, diet and exercise. These are preventable. Then the microvascular complications are retinopathy, that is reduction of blood supply due to thickening of the arteries in the screen of the eye. Okay, the eye has a screen called the retina, where reduction of blood supply to this place is called retinopathy, and eventually this leads to blindness in a large sense. And then nephropathy, that is the kidney getting affected because not enough blood supply is going to the kidney. And the last one again is very common but very troublesome complication called neuropathy, where the nerves in the ends of the feet and the legs do not get enough blood supply, and the nerves get inflamed and it's called neuropathy. The nerves are getting affected. Nephropathy can also lead to sudden rise of BP because when the kidney is not functioning properly, adequately, the blood pressure shoots up and not enough of nutrients are being supplied to the body. So this is also a complication. So in effect, to prevent the complications of diabetes, you need to do a regular check of blood sugar, your fasting sugar, your postprandial sugar, and the 3 months average, HbA1c. At least once in 3 months you need to do that. And the best place for that is of course Apollo Hospital, Chennai, where we have a very good preventive health checkup department and a good system. Okay, and it's called Pro Health. And if you come regularly, at least once a year for your regular checkup, and for your sugar checkup once in 3 months, we can do the checkup regularly and reduce your sugar so that it doesn't lead to further complications.